Hello, everyone, and welcome to the Commentator Ninja channel. My name is Mary. I'm the Commentator Ninja, and today we are going to talk about some pretty important topics in the sport of ninja, and that is injury prevention. I have here today with me none other than the amazing Dr. Ellie Hart. Hello, Ellie. How are you?
Thank you so much for having me, Mary.
I'm so excited. So, everyone, I'm going to give Ellie's ninja introduction because, I'm the commentator ninja. That's what I do. And then I'm going to let her talk about her background in sports medicine. That's why she's here today. We have seen a lot of injuries in the ninja community lately, especially ACL tears in female athletes. We're going to dive into that today. And perhaps we'll do another episode about shoulder health because all ninjas have shoulders and all ninjas need good shoulder health. So, here's Ellie's ninja introduction. If you don't know who Ellie Hart is, you clearly have not been paying attention. So I first became aware of Ellie probably like 2019, and I was just like, oh, okay. I gotta watch out for this one because she is a competitor. She was absolutely just the fastest ninja to any point ever. So her resume here in season, I think it was season 6. She was my pick for regional world champion or for regional champion, New England regional champion. She won, went to worlds, third place. And throughout that season, and I think a little bit after, she wasn't just always the top performing female athlete, but also beat all of the other men in the adult male division as well, pretty regularly. So she's a baller athlete. Little known fact, unless you follow gymnastics medicine, she also competed as a level 10 gymnast at the age of 23, which, if you don't know how hard that is or how uncommon that is, I'll just tell you it's hard and it's uncommon. So she's a super cool athlete, but she is also a super smart person. She's a doctor. Dr. Ellie, why don't you take us into a little introduction? What got you into sports medicine? What are you doing with that right now? And then what is your favorite ice cream?
Awesome. Thank you so much. And thank you for the great intro, Mary. It's always humbling to hear you give us our intros because they're always so fun and I really appreciate it. So thank you for having me.
Of course.
Just a little background about me. So I started gymnastics at the age of 3, fell in love with the sport, but unfortunately had tons of injuries. And we are talking fractures in my back, fractures in my wrist, 2 knee surgeries. So naturally, I was in and out of that sports medicine office quite frequently. And for those who sort of aren't aware of kind of the medical system, so you have generally your pediatrician who you go see for regular wellness visits and checkups. But if you have an injury, you get usually referred for a bone injury, a muscle injury, tendon, ligament, dislocation to usually orthopedics. And then within orthopedics, there's a subdivision called sports medicine. So I was a frequent flyer, if you will, to the sports medicine clinic from all of my gymnastics injuries. So that's what initially got me interested in the field, understanding the field, kind of knowing what's going on there. Then I went on and did college gymnastics at James Madison University, where I did D1 there. Loved it. Still had a lot of injuries, but got
Oh,
me
no.
interested in I just kept going with my injuries. But then I essentially started, my major was athletic training sports medicine with a minor in biology. So when I graduated, I became a certified athletic trainer. So for those of you who don't know, those are those medical providers who are on the sidelines, who when an acute injury happens, they are usually the first to respond. So actually, we've seen a couple at some ninja events. My hope one day is we get an athletic trainer at every ninja event
Oh
because
man.
I don't know about yeah I don't know about
Yes.
you, Mary, but I put in a couple shoulders, I'll put it that way, at a few events that I was at, and looked at a few knees. And so I was sort of the resident athletic trainer, going back to my roots, at a couple competitions. But that's what an athletic trainer is. I then went on, I said, I really love being on the sidelines, but I want to be more in clinic, in the operating room. So I went on, first got my master's to become a physician assistant or PA. And then after that, I sort of saw the need that I wanted to further my education and then did my doctorate after that. And then the really cool fun fact is I work for Boston Children's Hospital now, where not only do I have a gymnastics specific clinic, but I also have a ninja clinic as well for all those ninjuries out there. So very exciting. I gave Mary a sneak peek of my clinic ahead of time,
It's
and
super
there
cool.
is a ninja wall in there. and also a chin-up bar and some gymnastics equipment as well to kind of talk about that return to play protocol and the biomechanics, meaning the way that you move in essentially a sport or athletics that can predispose you to potential injuries. So that's sort of my little background, if you will, about what I do, where I got to where I am today. So.
And what was your favorite ice cream?
Oh, right. And of course, and what is my favorite ice cream? So I'm going to get a lot of flack for this. I am well aware. My favorite ice cream is cotton candy.
I was gonna try to be like super positive about it. No, cotton
Yep.
candy.
No.
No, I don't know. It's an ice
It's
cream.
good.
Yeah, like
So I'm gonna throw it out there. Okay. It tastes more like kind of like a milky, creamy with a little bit more sugar than true cotton candy. So if you haven't tried cotton candy ice cream,
okay.
go try it for me. And then everybody in the ninja community, you report back to me. When I see you at the next comp, you tell me what you thought of cotton candy ice cream.
Okay, I am gonna have to try cotton candy ice cream now because I actually don't think I've ever had it. Um,
There you go. And knock it till you try it.
yeah. So I did not realize, Ellie, that you have a ninja specific clinic. And I think that that is really, that's information that I want to get out there because I think that there's just a lot just in the ninja community in general. Like there are a lot of like nagging injuries, right? That, you know, if you have a coach that's had a couple of injuries, you can kind of like walk you through it and all of that. But for ninja families to know that there is a resource in our area that is specific to ninja and getting back to its sport, like especially for the kids like who've been doing it for so long, that's awesome. So tell it, how could people find you if they wanted to come and see you?
Yeah, excellent question. So I would say our ninja clinic is definitely newer. I've had the gymnastics clinic pretty well known over the past 5 years or so, but ninja was my expansion, really focusing on it predominantly over the past 6 months to a year or so. And so I am located at Boston Children's Hospital in Waltham, Massachusetts. So we are at the satellite. There is free parking, so you don't have to go all the way into Boston, which is awesome. Excellent, exactly.
Yeah.
And the really cool part is I see athletes from ages 6 all the way to 86. So I can even see adults. So even though it is Children's Hospital, I can actually see everybody, which is really great. That's part of my training. And then the really unique thing and really great aspect as well is just as Mary was saying, even for those nagging injuries, I can see if for an acute injury, so something that happened right in practice or at a competition, because I have x-ray right on site, MRI right on site, which is a fancy test to look at ligaments and tendons. And then also what's really cool is we can do same day visits, we can do next day visits. So I can get you in pretty quickly. I accept all insurances, which is awesome. So we can figure out essentially what is going on with you as a ninja, or if your child has an injury, we can get it worked up really quickly. And I feel fortunate that I'm connected to some of the best surgeons in the country, as well as in the clinic. We physically have a sports nutritionist, a sports psychologist in the clinic. So I can refer you also if we need some of those multidisciplinary team members to be part of your care. So I am at Boston Children's in Waltham, and I would love to see if you have an injury or a ninjury. Would love to see something for that. Had to throw that one in there, Mary. You know what was coming. You know what was coming.
I did.
Yeah, so and I can shoot you the details of my clinic info to you with the number to call as well. And like I said, my promise to all my athletes, whether you're a ninja or not, is that I get you in either the same day or the next day, as long as I am here in Massachusetts. I do travel a little bit for work, and so as long as I'm in essentially the state of Massachusetts having clinic, I'll get you in that day or the next. That's my promise to all my athletes. I understand the importance of making sure that you get your care quickly and efficiently, which is why I talked about the same day x-rays, same day MRI, because in ninja season, it is long, but it's also short. And we're all trying to make it to Worlds. We're all trying to do our best by the end. It's important to know what's going on really quickly. And the other cool part that Mary got a sneak peek of is there is a little ninja wall that's in there. So when it comes time to get back to the sport, what's really great is I can actually see your technique. I can see what muscles are being activated, look again at those biomechanics, and kind of figure out how we can prevent the injury in the future as well.
That is phenomenal. I think injury prevention, it's something that I talk a lot about at Ultimate Obstacles. My teenagers make fun of me for my injury prevention workout all the time. It's something I will probably never live down, but I'm okay with that. So I really wanted us to talk about ACLs and ACL tears specifically. So there have been a lot of pro female athletes over the years, and especially recently, who have had ACL tears. And I also have worked with a lot of female athletes at our gym who are concerned about their knees for whatever the reason, concerned about their ankles, concerned about all of that. Ninja, I think, when I look at the sport of ninja, it's a new sport, right? It's a very new sport, and it trains very specific skill sets. And those skill sets are constantly changing based on the trends of the sport, what's popular in course design. Agility is really big, but balance isn't big yet, but I'm hoping to make it big. I like balance. Obstacle tech, power endurance. It's a constant changing skill set. And so we're always training something new, but I would venture to say, in general, training kind of the same muscles over and over again. So I'd love to hear from you, Ellie, as someone who's entered into the ninja space and trained with ninjas, what are some of the things that you see that are kind of red flags from someone in your profession? And then let's dive deeper into ACL tears. Why does it happen? Why does it happen to female athletes, it feels like, more often than male athletes? All of that good stuff.
Yeah, definitely. So if we just start generally about ninjuries, if you will, kind of no one's really done a study to say what is the most common injury that's out there. So right. Sort of one little side tip, if you will, is I will be sending out a survey very soon in the next couple of months that'll be asking about ninjuries and when they happen. So we'll be actually collecting data. So I can give you those exact numbers and tell you what the most common ninjury is out there. So we actually don't have that data yet. If you look through research papers, publications, there's lots of stuff about soccer injuries, football injuries, but we don't have those numbers for ninja because, like you just said, we're a growing sport, we're a new sport. Each sort of comp I feel like I go to, something is new and different that I've never seen before. Constantly changing, which is great for the sport. But we do need to start doing a little bit of research on what's going on and what injuries are happening. So generally speaking, from sort of more observation, what I've seen is there's a lot of ankle sprains if we're starting out with that. And that's true for any real sort of sport or athlete that's out there. The most common injury is usually an ankle sprain. The second most common injury is usually a knee injury, specifically usually an ACL tear or meniscus tear. And we'll talk about what those are in just a second. But then when I think about ninja and sort of my friends, my colleagues, what are their injuries that are happening? It's also the shoulder as well. So things like the rotator cuff being torn or strained, which are the muscles that hold your shoulder in place. And also things like labrum tears, which is when a shoulder sometimes dislocates or comes out of place. That could be torn. So I would say if we're thinking of ninja, I think we're thinking about ankle sprains, ACL tears, and shoulder injuries. So those would be our main ones. But I think if we start out with the knee in particular, let's just start out with the basics. So truly thinking like, what the heck is a knee? Because I got these great models here that I gotta use. Because if I'm gonna be educating, we gotta know what the heck is inside the knee. Yeah. So thinking about this straight on, this is your shin bone or your tibia. This is your fibula, that's on the outside here. Then you have your femur or your thigh bone up top here. You have your kneecap or your patella right here, the patellar tendon, and the quad tendon. Now, if you take all these things away and we're looking inside the knee now, we got our meniscus, which is this squishy cartilage right here. And then if I push this guy down just a little bit, sorry, our meniscus moved, which is not a good sign, by the way. But we see that in here, actually, this one already has an ACL tear, ligament, that's not right in there. Yes. So luckily I got two models for you. So hold on, even better. This one does have an ACL that is in here. And if I move your kneecap out of the way, you can see this red line that's right in there. So that right there is the ACL or anterior cruciate ligament, and why I think it's important to talk about it and understand where it is. It is inside the knee, meaning interarticular. So when you do tear your ACL, which is usually a plant and twist mechanism, what happens is your femur or your thigh bone and your shin bone now slide forward. So it's not able to control that movement. And so the reason why this is typically operated on is you can picture if your leg is now going to be sliding forward, that meniscus or shock absorber that's inside your knee can also be torn and injured. And then later in life, there tends to be more arthritis and more knee pain and more problems. Now, that being said, traditionally an ACL tear is treated with surgical intervention, so meaning a day surgery that you come in for. But unfortunately, studies are showing that 15 years later after an ACL tear and reconstruction, those participants are more likely to also have osteoarthritis, so meaning wear and tear of the knee at an earlier age. So really the prevention is not having an ACL tear, right? So that's our big goal, is actually preventing this from happening, because no matter what you do, if you've torn your ACL, unfortunately, you're now at an increased risk of arthritis later in life, which is what we don't want to have happen to our young ninjas that are in the sport.
Yeah.
So questions at all about the knee before I dive into sort of females and ACL injuries and things like that?
Yes. So when I think of the obstacles we use our knees for, so everyone might think when you train legs, right, like warped wall or agility, but I think that another really important thing is every ninja has to land somewhere. And the crazier the gym you go to, like what you're landing on, it might not be stable. I have definitely watched ninjas land and then their knees go inward. They land to the side, and there's all these awkward positions. Sometimes when people are running up the warped wall, there's like, I don't even know what I'm seeing in a lot of cases. And so I think that, and I'm sure we'll get into this, right? You mentioned good mechanics, right? Good landing mechanics, just using your body the way it should be. I think I'm saying this just to be more of a plug for your clinic here. Like, you don't really think about landing as a ninja skill, but when it comes to protecting all of the joints in your lower body, that's huge. That's like, I mean, you're doing just as much lower body as you are upper body, because you land for every obstacle. Yeah.
It is true. Yeah. And especially even getting off the obstacle, right? There's usually a platform that you're landing on. Maybe there's a weird twist that you're going to.
Yeah.
So totally agree. I think one of the basics of ninja should be learning how to land safely, right?
Yeah.
How to be able to absorb that force, how to be able to absorb the impact. As sort of an awkward or weird landing that might occur and might occur by accident too, right? Like you mentioned, you're not always ready to land on a certain type of surface. So we actually call that working your proprioception and balance. So proprioception is understanding where you are in space as you're moving and having your body react to that. So that's actually a key factor to work on actually knee injury prevention and also ankle injury prevention is practicing proprioception and balance. So simple ways that you can do it is kind of getting ahead of ourselves, but that's okay. Is by honestly just standing on one leg. And it sounds so silly, but you stand on one leg, you get your balance, and then you close your eyes. And you try to do that for 30 seconds. If that gets easy for you, then you stand on an uneven surface. So maybe a wobble disc, maybe a Bosu ball, in a safe place, of course, where nothing around you. If you fall, you get hurt. And essentially then try that with your eyes closed. And you'll notice that this is actually a learned behavior. So you'll get better and better and better at this. And then when this translates to actually landing on an obstacle, if it is wiggly or wobbly, you've already trained your body on how to react to that so you don't fall over. So it's called working your proprioception. That's a really great skill to avoid knee injury.
And I will say that's actually just connecting it to ninja and what we're seeing in the competitive field right now. So I'm seeing a lot of agility style into something, right? So you're taking an ice pick with you, you have to go over some wobble boards, Diamond Dash. Let me use actual obstacle names here. And then you're hooking it into it. So there's always that kind of like panic moment where we're like, crap, my footwork is really important, but also I need to look at where my hands are supposed to go. That is actually phenomenal, because if you can do that with your eyes closed, sense where your body is in space, that's going to help you even more with those types of obstacles, just being really confident to say, okay, I know that if I do have a misstep, I'm going to be able to correct it. I'm going to be okay. So that's more plugs for this stuff, guys. More plugs.
Exactly. More plugs for injury prevention. Let's prevent those injuries, everybody. But yeah, and then if we're thinking truly about kind of ACL tears, what are sort of the incidence of them? So ACL tears, there's about 400 per 1,000 persons per year. So that's how we usually report sort of statistics that are going on. The hard statistics, though, about having an ACL tear and then getting back to the sport, there are upwards of 45% of patients who are unable to return to their prior injury level after an ACL tear and reconstruction. So 45%, that's a huge number. So again, stresses the importance, right, of preventing an ACL tear from happening from the beginning.
Absolutely.
Also, when you think about someone who's had an ACL tear and then reconstruction, there's actually a 20% chance to that person that they're going to either injure that same knee or the other knee and having either another ACL tear or even meniscus tear as well. So again, stats are getting higher and higher for injuries even after this has been already treated. And then when we're thinking about females compared to males, females are somewhere between 2 to 8 times more likely to tear their ACL than a male is. So that's a huge statistic when we think about numbers right there. And I think kind of thinking, well, why does this happen, right?
Yeah.
What is the reason that females, right, are 2 to 8 times more likely to tear their ACL than a male? So a couple of factors that unfortunately go against us female ninjas. So the first and foremost being biomechanical factors, right? So women have hips and what we call a Q angle versus males are more straight sort of positioning. And that's just your pelvis and your hips, right? I don't know males at the moment with a straight pelvis that are having a baby, but traditionally the wider hips are set for essentially anatomical purposes for reproduction. So that's sort of the reason why we have that different Q angle that's there. The second is I love all my females, so I hope I don't get hate for this, but when we think about strength, right, and the ability to have like bigger muscles, right? Men are able to produce stronger muscles in quadriceps and hamstring areas that then help us prevent injuries in the future. Women are known to have really weak, what we call abductors, so the ability to pull your legs in. And so that's hip strength and gluteus strength are sometimes weaker when we compare them to the male athletes. So again, those biomechanical factors. Also, when you're thinking about just the angle of your shin bone or your tibia, women are actually a little more turned in. And so that turn in also causes more torque and twist on the ACL when we land, cut, and pivot. So again, factors that unfortunately as females right now, we can't change those factors, but we can work on strength gains and landing mechanics. And the other thing too that's tied to it is flat feet. So a lot of female might also have flat feet. So plug into anybody who's making a ninja shoe, reach out to me because we can figure out how to make a female ninja shoe to help prevent maybe some ACL injuries in the future as well.
Series 1. Series 1, I know you guys follow me and I just got to say, talk to Dr. Ellie here.
Yeah, exactly. Let's make it happen. Hey, I'm always looking for a business deal. Let's do it.
Yeah. Hey, I want an Ellie Hart Series 1 shoe. I want the pink and purple. Like that's
might be some pink and purple, exactly. So those are sort of the biomechanical factors of sort of the way that we're set up anatomically. Now, I of course have to talk about hormones. So males and females have different hormone levels as well. Now, it's not a perfect science or a perfect study yet. Different things have come out. So there's been some studies that have said if you're on your period, you're more likely to have an ACL tear. Other studies have said no, that's not the case. But the general consensus is that females have a higher hormone of something called relaxin. So relaxin hormone, I wish it was making you relax, but it does not. What it does instead is it actually relaxes the ligaments, so it makes them more loose. So in general, women tend to have more laxity in ligaments. Again, it goes back to reproduction, right? So when you're having a baby delivered, you need to be a little more relaxed, if you will, in those ligaments. And so the relaxin is higher in females than it is in males. Other things too, when we're thinking about other hormones, those also sometimes predispose us or again, make us more likely to have more loose ligaments and less essentially testosterone that's in us. So again, our ligaments themselves are looser. So that when we think about the ACL, right, if you have a looser ACL, it's more likely then to tear. So unfortunately, from a hormone level, that also is playing against us as well. And another interesting fact is when we think about ACL tears, and also I think we're seeing them more commonly commonly in female ninjas than we will in male ninjas, is just the general statistic is a female is more likely to have a non-contact ACL injury versus a male is more likely to have a contact ACL injury.
Right.
So what that means is thinking of contact with someone else. So usually they're running and they're being tackled by someone, right? Yeah. A plant and twist with another force on top of them, versus a female is usually jumping down off of something. They're going to cut really quickly and nobody was pushing them, but they just planted and twisted. And so that's why I think we're actually seeing probably a lot more in the female ninjas, right? It's a non-contact ACL tear. Is what we've seen with sort of all the ones that have come through, if you will, in the elite ninja crew. So
so injury prevention is your key, right? Like there's definitely great interventions, great return to sport protocols, pioneered by you yourself, which is phenomenal, but we want to prevent that injury, right? So what would you say, let's kind of back it up a little bit. So we train legs in ninja, but I want to say hamstrings are not given too much love. So I know that's a big piece of it. What are some other muscle groups that just don't get training in like a regular ninja training session?
Yeah, so I would say in general, sort of more of like the side to side movements. So more lateral movements versus front to back, right? So everybody thinks about a course, we're going straight down, right? However, sometimes now we're seeing we're going side to side. So working on those lateral movements, right, would be really important. And also a lot of single leg landing, a lot of single leg absorption. So the knee coming in is called a valgus force. So if we can practice a lot more single leg landings without a valgus collapse, meaning the knee coming in, that'll also help us as well prevent knee injuries and other injuries in the future as well. So I think working kind of single leg work in a side to side or lateral plane, and also putting you in safe places to practice those different types of landings and landing mechanics. I think honestly that's the biggest thing, is jumping off of a block and being in a safe position. Jumping onto a squishy surface and being in a safe position. So I think those would be really important as well. Another factor too that probably contributes a lot to the female injuries is access to care and access to strength and conditioning gyms and facilities and training sites. It's been documented not only in ninja but in female soccer, for example, right? The different disparities that are between the men's and women's team, despite sort of the success in one group versus the other. So even just doing your podcast, Mary, is fantastic, just to get that information out there, that there are, right? There are places and facilities that you can do injury prevention work and strength and conditioning, and the importance of including that, not only just doing ninja obstacles. I think that's definitely important. And other thing too is fatigue, right? So the emotional aspect of also doing ninja and being a part of it and being at a competition, just in general, fatigue and emotions play a huge role in how we do and also preventing injuries. So checking in on yourself, working with a licensed provider to handle if there's anxiety around competition or practices or certain skills or doing things, that can also help decrease our chance of injury as well, which is almost just as important to train our bodies, but to train our minds too. So.
Absolutely. We, so I actually started a sports psychology program at the start of this year, and it's really exciting. And we've kind of put together it's a very basic level, but some basic level training for the kids at our gym, which I've been really excited about, but I think it's just very needed in the sport, especially because we've been growing for about 10 years. So we have a lot of kids that are very high level athletes, right? So they started when they were young, they're hitting the teens, they're hitting the elites. And unfortunately, a lot of the mindset from past ninja lore is just, you just go, and you don't stop. Train hard, no days off. And that's been kind of like glorified, if you will. That's like, oh, that's like what a real ninja does. Like, oh, the skin's ripped off my hands. Like, just put some tape on it. Keep going. Your lats feel like they're going to fall off. Do 10 more pull-ups, like, that sort of thing. And so I think that, we've started to try to dial that back in our program to just be like, hey, if you need a break today because you're not here, like, that's okay. If you are so tired to the point that you don't think you're going to complete an obstacle, you don't trust yourself to do the obstacle, don't do the obstacle. Come back when you're ready to do it. Come back when it's going to be worth it to train. And, you know, I don't know if there's a full understanding of the value of just taking that pause and pulling yourself back from it. So thank you for saying that. Because
No, yeah. So you guys are spot on what you're doing. And I'm sure Jordan at Vitality will tell you I take my hiatus. I'll put it that way. So
yeah.
I actually anywhere between 1 and 3 months of ninja. So I don't do anything ninja related for 1 to 3 months a year. And the reason is exactly what you were just saying is the burnout, the fatigue is you have to regroup. You have to get back into that mindset. The training is hard, just like you said. And so if you're not mentally there, it's not smart to be on, a 12-foot high obstacle, for example, right?
Yeah.
Like you shouldn't be there if your mind's not clear. So I commend you on adding that into the repertoire and practice schedule. And I hope more gyms, if they listen to this, will start either reaching out to you or other facilities to add that in, because the mental aspect in training is so important. And other things too, right? Sleep, nutrition, hydration, all those things are just so important to be focusing on. And not to go back to the females, but even, having a period, right?
Yeah.
Everyone gets all squirmy when you talk about it, but you should be having a period. You should be having one every month, even if you are a high level athlete. And if you are not, or you're skipping periods, definitely reach out to a sports medicine provider. We also call them female athlete providers. You can reach out to me if you'd like. I'm always happy to help, because it is important. Having a period monthly is something that you need to have, not only just for general health, but also for bone health. If you're not getting a regular menstrual cycle, you're more likely to have bone injuries, stress injuries, and even osteoporosis when you get older, which is brittle bones, which you don't want to have. So I think all those things just need to be more addressed within our community as well. So,
well, Ellie, thank you so much for talking about ACL injuries. Ninjas, we're going to be back with another episode, and we're going to talk about the all-important shoulders, which are, that's going to be a whole thing. That's going to be a whole thing because shoulders are so important. So Ellie, thank you so much for being on the channel, and I can't wait to see you back for part 2 for shoulders.
Thank you so much for having me, Mary. It's always an honor to be on here. And I just love what you're doing with the ninja community, and this education is just so important. So thank you so much for having me, and I look forward to part 2 of making some improved shoulders.
Yeah. All right.